move to our next panelist for some opening remarks, Mr. R.P. Gupta, who's a member of the advisory group and TRG, the Technical Resource Group at the Ministry of Health.
Thank you, Vivek, and it's a pleasure to be here at FICCI and speaking on health, which is not an easy topic. So I have these 4 questions, to address and share with you. First is the rational learnings from the free medication pilot conducted in Rajasthan. So I had a first-hand experience being in Rajasthan. I was representing a union minister for a massive health camp that we did in February in Ajmer. So I had a lot of interaction with doctors. So I'll quote you 2 live experiences that a doctor shared with me. He says a person comes to me and says, "Saab, khansi ka dawai de do." So when I ask him, "कौन सा खांसी है? टीबी वाला खांसी है, सूखा खांसी है, कौन सा है?" "सर, आप बहुत बहस करते हो. सरकार फ्री में दवाई देती है, आप क्यों नहीं दवाई देते?" He says it is really insulting to see that kind of questions from someone coming. And if I succumb to the pressure and I give him, the person standing behind him says, "Sir, माता जी की कमर में दर्द है, मलहम दे दीजिए." And he says this has become a routine. So you can understand a very good program started by the government aimed at giving relief to poor by providing medication, which is a huge expense for poor people, turns out to be bad because people abuse and misuse the program. Now that doctor had a statement which we corroborated with a lot of people whom we talked. He said, "Sir, we are not doctors anymore, we are compounders." क्योंकि अब वो लोग बताते हैं कौन सी दवाई देनी है सर्दी खांसी की. And the fact, if you really see in Rajasthan, of course these are based on experience, so I'll not say you can generalize it, is a fact that the medical consumption has gone phenomenally high, but is more of misuse than use. And of course it is people's approach to it, and if the doctor doesn't give, he will bring a politician to insult him, so the doctor prefers to write the medicine. Now what I have been asked to speak is what are the rational learnings. So I think first thing as a practice should be not to prescribe medicines unless you have a patient physically examined. How practical it is to implement is a question. The second thing is, I still believe to have a co-pay as a system. So if you ask someone to pay 5% or 10%, you'll see a change in approach. I mean, it's a typical Indian psyche that if I say medicine is free, तो बोलेगा सर 15 दिन का मतलब को अब 1 महीने का लिख दो, मैं बाहर जा रहा हूँ. And if I say आपको 10% co-pay करना है, this is जो जरूरी है वही लिखो आप, and just give me 7 days. So I think this is something the government must consider, is to have a co-pay in whatever is free. I mean, anything free, I mean, we have seen it is, you go to US, the percentage of GDP for health is increasing. It has become a $2.74 trillion industry. Our economy is not even $2.74 trillion. You go and see NHS is a bankrupt system. Europe is a bankrupt system. See, once you give a blanket guarantee to people for health, first people don't become responsible, and then irresponsibly behave when they go to seek healthcare. I think these are the 2 learnings that I will say. And the second is, of course, the 100 district diabetes screening program that I have been asked to talk about. I think I've been a part of many meetings, and I really appreciate the way our senior officials and the minister has been looking at healthcare. And Dr. Jagdish Prasad is a senior official, probably one of the most powerful people sitting in the room itself. So, this is a great program. If you screen the population, you will know how many people are suffering from which problem. Predominantly 3 basic problems if you catch up: obesity, diabetes and hypertension. You'll be able to by and large address a large part of our medical problems. Last year it was announced that we will do 20 crore by March. Of course, intention is always good to do it, but the reality is that the number is big. Finally, as we talk, it's reaching 1 crore, which I think is commendable. We should appreciate the Ministry of Health, because 10 million is like population of Finland and Norway, or even Finland and United Arab Emirates. It's locking up 7-8 countries. It has been done in a matter of 1 year, Jagdish. Last September it was announced. So, yeah, 9 months. So if in 9 months you can do 10 million, it's a great achievement. I mean, you have covered literally like few countries in Europe. We should appreciate this has all been done by government. I did evaluate. I actually wrote one article for CNBC on screenings, and specifically this program where I talked about. Here it is an ask that what learnings and what element in the ecosystem needs to be tackled to accentuate the impact. Now, here I have a suggestion, or rather a submission, is imagine 200 million, that's 20 crore people to be screened in 1 year. So let's even think that we want to really do it and put every effort possible. So one of the things we need to focus is, of course, there are multiple channels. Even the government can do it free without investing money, but that's a different model to look at. Since the government has already planned, budgeted and is doing it, one needs to look at the channel. See, today we have 500,000 chemists in the country and is the last mile link for healthcare in the country. There may not be a hospital, there may not be a doctor, but go to any part of the country, you'll find a chemist. And the only point where everyone trusts him, if there is a small ailment, someone will go and say, look, पेट में दर्द दवाई की बताओ, कोई क्या से लेना है, बुखार ठीक नहीं हो रहा, दवाई बताओ. So he is the first reference point. So if we take 200 million people to be screened, if a chemist can do 10 tests a day, which is very much doable, he will do 300 in a month and 3,600 in a year. You actually require 55,556 chemists. So if you were to do for 600 districts, you require 92.6 chemists per district. Imagine if you roped in an FDA inspector for every district. We have FDA inspector and they work with chemists. Essentially, they have a good say. You would actually end up doing this entire thing in 1 year. And entire country above the age of 30 can be screened in 3 years' time. Plus, there are other channels. There are a lot of pharma companies that regularly do camps. They anyway invest. If you have funds, there's other channel to work with them. But this is where, you can actually do things faster and better. I think one needs to really look outside, open up the mind. So I don't think it is not doable, but I think ministry is really going ahead, doing well on this. And it's a massive program. I think we'll wait to see. I was seeing the numbers and it's like 6.49% people are diabetic, and 5.18% people hypertensive. And I think we are already capital of many things in the world, and it's a matter of shame, but the fact is a large part of population has also behaved irresponsibly on lifestyle, diet, and we can't blame the government simply for that. If the government comes down to screen you and say you are unwell, unfit, I think government is doing its job. The third thing I have to talk is the ideal NCT program for rolling out on the PPP. I think the first program government has rolled out is really great, is to screen everyone. That's the starting point of identifying NCTs. The second thing we need to do is a secondary prevention program. I think the stage of primary prevention for this country has gone long back. It's the time to put a secondary prevention program. So you find out people who are diabetic, you find out people who are hypertensive or obese. 44% people were obese when we did risk management in the country, with the targeted population. I think 2009, 3 years back, we had 44% people, obese. And obesity is the root cause of major circulatory chronic disorders, diabetes, hypertension, even CVDs. So I think here it's a good opportunity. A lot of private sector players have focused on chronic diseases, chronic disease management. They are leveraging IT and bringing solutions. I think it would be good to say, okay, look, we screened and we found 65 million people suffering from diabetes. If they all move to district hospitals or our hospitals, then you can imagine the load that will be there on the specialist. And we are already having 66% shortage of specialists under NRHM in the primary centers. So I think there is a great opportunity to do a secondary prevention program with the private sector, identify the boundaries, and that could be something good to look at. The last point I have to address is how can the private-public sector join hands to enhance integrated approach to healthcare. Now, this is where I want to put a word of caution. So there are two discussions. I had the chance of working for first decade and a half in the healthcare corporates. Second, I have worked advising corporate and even on advising the government in India and Middle East. I have put in the planning commission, been a part of a lot of discussions of Ministry of Health. I would say there's a big gap that I see. The industry feels ministry doesn't do anything. Probably some people in the ministry feel that industry is there to profit here. It's a totally misguided perception. If you really peep into ministry and see how much people are working and what is coming out, it is unbelievable. There are so many programs going on. Mr. Prasad has already highlighted you. So much money is being spent. The intention is all good, whether it's free medicines, whether it's mass screenings. Industry should think before saying we are critical about the government. And second thing, also the government has to be working with the industry. That's the way we can execute things much faster, much better for this country. Whereas these forums are good. You can meet for 1.5 hours, shake hands, exchange visiting cards, past pleasantries. What we need is a continuous dialogue. You need to understand each side. Government is a monolithic structure. They have legacies. 1.21 billion population is no small number. I mean, people say, I keep saying, if you really look at India, don't expect quick changes. Even a small move is a big number. If you say 2% of the population, you have covered 5 countries in the world. So understand that it is not easy to move things and get things done. I mean, as we talk, there are people must be working in the ministry right till night to get things rolling. So it is better that both people sit, talk, understand. Once you understand, don't think things will work out well. You need to appreciate each other. You would like each other. I know a lot of people and the way they put in work. What they get is still rebuke at public forums, which is not the way to look at. If you really want to go, sit with them, discuss what they are doing, understand it. I am sure that 99% of us will go and appreciate what they are doing. If you really want to work, whether it is private-public partnerships or public-public partnership or private-private partnerships, you still cannot ignore the government. You need to sit with them, understand, like, appreciate, find a common ground to start. I think today the number of programs that are getting rolled out, whether it is primary prevention or a secondary prevention, mass screenings, enormous opportunities. I think what we need to do is first understand and appreciate. Otherwise, one word will remain private-public partnerships. It will never fructify. One needs to understand both sides. That's all the message I would send. Criticism is something that I would stop at doing, because I think there's a lot of work to do, and a lot of work to do jointly. That's all. Thank you.